Process improvement involving length of stay metrics. The definition of length of stay can include a duration of a hospitalization within a healthcare organization. The significant issue that will be discussed within this PowerPoint includes length of stay outcomes. A clinically significant issue found within my practicum site can include length of stay outcomes, which has ultimately negative affected throughput, leading to extended emergency times within the organization. And then with that, recent data related to length of stay within the months of September, October, and November has yielded data of 1.19, 1.21, and 1.22. Within the practicum site, a length of stay target of 1.13 was created for the organization, and normally our baseline has been 1.19, which ultimately indicates a need for performance improvement. So increased length of stay can have a negative impact within a healthcare organization. It can affect patient safety, quality care, or mortality. So we've decided to do a process improvement related to length of stay, and we implemented 3 things to improve length of stay within the organization. This can include the anticipated discharge whiteboard, the implementation of interdisciplinary rounds, and then the early mobility initiative. So the anticipated discharge whiteboard is the implementation within each clinical unit. It's basically just a whiteboard focusing on discharge needs, discharge barriers, discharge times, and then the date. And it also includes getting patients out prior to 10 a.m. Early discharge trays, rides confirmed, and discharge education would also be available on the whiteboard, just as a visual for the nurses and any disciplines looking at the whiteboard prior to discharge. This whiteboard would be visible for every discipline to see, so that they really can all have accountability. And then the symbols will be utilized to fill out the whiteboard to prevent violating HIPAA. So this is just an example of the anticipated discharge whiteboard that will be implemented within the organization. So for example, room 112, we have the attending physician, Dr. J. The discharge needs is that little lunch bag, which on the next slide we'll talk about the symbols. The discharge barriers, there are none. So we have the discharge date of 3/11 and then the goal time of 9 a.m. So this is an example of the key. So the little lunch bag means meals. The little clipboard means physician orders. You have a P for sniff placement and then O for oxygen. And then this key would be placed on the board so that everybody could see what they mean, but it's not being written on the board. And then this is the early discharge tray, ride confirm, and discharge education, just to facilitate discharges within a timely manner. The interdisciplinary rounds implementation focuses on a interdisciplinary round refresh education for all disciplines. This includes one-on-one education and role-play presentations. It focuses on the primary nurse, the charge nurse, the case manager, and pharmacist, all doing bedside rounds. And then implementing the discharge checklist, which is the evidence-based practice process that we implemented. And then it includes the charge nurse being accountable to this for follow-up. And then the interdisciplinary rounds just focuses on the 3 main goals for the patient. So it focuses on the plan for the day or the goal for the patient, the plan for the stay or the goal throughout the hospitalization, and then the plan for the way, which is what is going to happen after discharge. So next talks about the early mobility initiative, and all patients should be up for all meals, so breakfast, lunch, and dinner. There should be early PT consults, and then walking in the hallway 3 times a day for those who are able to. So literature review regarding anticipated discharge whiteboards. Evidence-based practice speaks to the importance of utilizing an anticipated discharge board. It's instrumental in providing communication between nurses across all disciplines. And it was found that it was length of stay was decreased, and then the coordination of care was also improved. And then literature review regarding interdisciplinary rounds. There was lots of literature revolving this. It focuses on the importance of, really it helps with coordination of care, patient safety, and the overall quality of care being provided within a hospital setting. Evidence-based practice states that a discharge checklist within interdisciplinary rounds can help with the coordination of discharge goals, identify tasks, and areas of resolution prior to discharge. Evidence-based practice also speaks to the charge nurse carrying the discharge checklist so that someone can be in charge and accountable for making sure that everything on the list is completed. And then it just talks about challenges discussed, including being vigilant with rounding, staying consistent, and then making interdisciplinary rounds standardized across the organization. And then talks about literature review regarding early mobility. Early mobility can enhance mood. It can decrease hospital-associated delirium, especially for those older folks within the hospital, and can decrease the length of stay for patients admitted within healthcare organizations. And then evidence-based practice has shown that early mobility improves patient outcomes and enhances quality patient-centered care. And then this talks about telehealth and the literature review revolving telehealth. Telehealth is discussed in relation to improving length of stay outcomes and improving throughput. Specifically, by creating more physicians within healthcare organizations, it can decrease mortality, length of stay, and patient safety concerns. So the target audience for this process improvement involves really all disciplines: nurses, physicians, patient care techs, respiratory therapists, physical therapists, case management, environmental services, and then leadership teams. And this target audience really was chosen due to the collaboration needed to improve process improvement within the practicum site. And then a system-wide approach will be implemented to decrease length of stay, improve throughput, and improve patient-centered care. So the ANA scopes and standards of practice most applicable would be standard 5 or the implementation standard. And I chose this because we were able to use evidence-based practice to help resolve an issue found within the workplace in order to enhance process improvement. And then we also utilized collaboration and incorporated new knowledge to be able to implement the process improvement plan within the organization. So the communication plan can include implementing a interdisciplinary round refresh focusing on ideas found within evidence-based practice. It focuses on implementing an education refresh on all of them discussed above, such as IDRs, early mobility, and then the anticipated discharge whiteboard. And the communication will be provided across all disciplines to improve length of stay and throughput. So the timeline for this, timeline for education on all inpatient units will be 2 weeks. Auditing for compliance with IDRs and the early mobility initiative will occur after the 2 weeks of education. And then auditing for implementation of the discharge whiteboard will occur during the same time period. So then full implementation of the new process improvement should be implemented within a month of education implementation. There was no excessive budgetary needs needed for this process improvement. We're going to focus on trying to get all education in during hours of business to prevent overtime with employees. The only thing was maybe small monetary contributions needed for the discharge whiteboards for each clinical inpatient unit. Evaluation methods will include auditing for compliance. So an auditing tool will be created to audit for IDRs, the discharge checklist, early mobility initiative, and then compliance with the anticipated discharge whiteboard. Evaluation methods for success with process improvement will depend on the future length of stay data for the healthcare organization. So the biblical application for this: whatever you do, work at it with all your heart as working for the Lord, not for human masters. Let us not lose heart in doing good, for in due time we will reap if we do not grow weary. Commit to the Lord whatever you do, and He will establish your plans. So, really meeting metrics within the work care and the healthcare setting can be important, but if that is all that we're focused on, I think that we are missing the point. I think it is far more important, especially from a Christian worldview, to work as hard as you can for Him and His glory, and God will supply you with all of your needs. And here are all the references.